Hi, I'm Prashanth. Welcome to day 4 of Prashanth Builds. So far, we have looked at NBS and compared different approaches to disease surveillance platforms. Today, I want to go one level deeper and look at where much of disease surveillance actually begins, which is the lab. A lab identifies a potentially reportable condition, and that information needs to reach public health and eventually becoming something an EP can act on. An ELR or electronic lab report is a critical part of making that happen. So when we talk about electronic lab reporting, we're not simply talking about sending a PDF. These are structured electronic messages, commonly using HL7 version 2 protocol. The message contains information about the patient, the test, the specimen, the ordering provider, and the performing lab itself. And it also contains the result standards such as LOINC, which will help identify lab tests, while terminology such as SNOMED codes can help represent results and clinical concepts. The challenge is that receiving a message is only the beginning. Once a message reaches public health, several things have to happen before it can become useful. First, the message has to be received and validated. Then the data needs to be normalized so that different labs and coding conventions can be interpreted consistently. Next, the person matching needs to happen. Does the lab result belong to someone who's already in the system? Then we determine whether the result meets the rules for public health follow-up. Depending on the condition and the existing information, the system may create a new case or associate the results with an existing investigation or send it for additional review. Finally, that information needs to reach appropriate public health team. This is where disease surveillance engineering gets interesting. Even when there is standards, the incoming data is always not necessarily identical. Different labs can represent similar information differently. Fields can be missing, addresses can be incomplete, results can arrive multiple times. A lab might send corrected results later, and especially during a major outbreak like COVID, the volume can increase dramatically. So a modern disease surveillance platform can't simply accept HL7 messages. It needs a strong normalization and processing layer between the source and the investigation workflow. If I were designing this capability today, these would be some of the foundational components. I would use event-driven ingestion so that message can be processed as they arrive. I would separate normalization and terminology mapping from the case management application. I would also have configurable rules for reporting, routing, and prioritization. Identity resolution would be a dedicated capability rather than something scattered throughout the application. Right? And of course, there needs to be observability, which is very important. Public health teams should be able to answer basic operational questions like what arrived today, what failed, what is waiting, how fresh is my data. Finally, the entire pipeline should be able to scale when message volume increases during an outbreak. The important takeaway is that ELR isn't disease surveillance by itself. It's the beginning of much larger chain. Right? We receive information, normalize it, determine who it belongs to, decide whether public health action is required, create or update a case, support an investigation, eventually turn all of that information into population level intelligence. And every step depends on quality of previous step. And that's why I think ELR is one of the most important foundations of a modern disease surveillance platform. And that leads directly into the next problem. Suppose, let's say, two labs send results for John Smith. One says John A. Smith, another one says Jonathan Smith, and the address is slightly different. Are these two different people or the same person? That sounds simple, but public health scale, it becomes one of the hardest problems in the platform. In day 5, we look at identity matching and deduplication and how modern surveillance system can be built using a reliable view of a person. And this is day 4 of Prashanth Builds. Thank you.